and welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and today I have with me Dr. Emmanuel Ofori of Bisa Mobile Health. Welcome, Doctor.
Thank you very much. I'm glad to be here.
Yes, I'm glad you're here too. And now tell me a bit about Bisa Mobile Health and what good work you're doing in Africa.
It began as an idea when I was in medical school. We realized that a lot of people didn't know a lot about their health records, and some also had questions, but were afraid to ask. So once I finished medical school, I collaborated with an IT expert, and we set up the Bisa app. So Bisa means ask in our local language, which is tree. So when you translate Bisa to English, it means tree. It means ask. So it provides an opportunity for people to ask any question they want, and we have a number of doctors on the platform who will provide them answers. So that was the main thing. That was the main reason why we set up Bisa.
Wonderful. Now, you've been in business for 7 years, correct?
Yes, we've been in business for 7 years.
Good. So now, are you serving the entire continent and globally, or are you focused more on your area in Ghana and the region near you?
Yeah, so the main focus is Ghana, but we've also expanded so people outside Ghana, that's within Africa, can also download the app and ask questions.
Wonderful. So now, tell me a little bit about some of the success stories that you've had. You have doctors on your platform and you're doing this to assist people. What are some good stories that you can share about how your product, how your service has changed lives?
Yeah, so one thing is we incorporated a service where people who don't have smartphones, and we provided this USSD code, such that people who don't have smartphones can ask questions. Those who are in the rural areas are able to ask questions. And we've also been able to collaborate with hospitals so that, and when we need to refer someone and it's an emergency, we are able to do that. During the COVID-19 pandemic, we served as one of the main platforms to provide information on COVID-19 and also help direct people when they had to test or when they had some symptoms and had to ask questions. So during that period, we collaborated with a German company, GIZ, to provide, and the Ghana Health Service, to provide information to people. And this helped in dealing with a lot of the questions people had during the COVID-19 period.
Wonderful. Oh, good for you. So now is this a free service to the patients and the doctors are paying for this service to get that reach? Or is this funded by the government perhaps?
Yeah, so since we began for the past 6.5 years, it's been free. But in order for us to sustain it, we've now begun to monetize it. But we've decided to make the rate very low. So people would have to pay maybe about 5 Ghana cedis to ask a question, which is less than $1. And for a consultation, which is about 50 Ghana cedis, it's also less than $10 to get a doctor to deal with you. So we want to make it more sustainable so that we can also expand, and also so that the other rural people can also enjoy the service free.
Oh, that's great. You're really helping people all over. So now you were in college when you were doing this. And so tell me, how did you get started? Because this is quite the endeavor, and it's not necessarily something that you're taught in medical school, right? When you're becoming a doctor, they don't tell you how to do an app like this. So how did you get started?
Yeah, so, and I actually started when I just finished medical school. So that was 2015. When we finished, I spoke to one of my friends who spoke to me about this idea. And I also told him that, during medical school, we realized that a lot of people did not have information about their medical conditions. People wanted to ask questions and they were feeling they didn't have answers to it. And some people were actually shy to ask questions, especially when they had questions that had to do with sexually transmitted diseases. So they may come and tell you about headache or abdominal pain just to throw you off and you may treat them for another condition. Later on, they may meet you outside and say, "Oh, doctor, that wasn't my main problem. My main problem was this sexually transmitted infection." So once we finished, I met the IT experts and we came together. Then we formed the app. Then, as I said, we made it free so that people can ask their questions. Then after that, we've been progressing from there.
Wow, what a great story. Oh my goodness. So if people wanted to find you, where would they go? Is it, and by the way, are you mainly reaching out to the end users, or are you also reaching out to new doctors to put them on your network, or is it a combination therein?
Yeah, so the main thing is to reach out to end users, which is the patients or our clients. So what they have to do is to download the app, which is on Google Play Store and it's also on Apple iOS. We also have a website, which is ghapp.bisa.com, that people can also visit and sign up. Once they sign up, they'll be able to ask any questions. Then any doctor on the platform would provide an answer to them.
Wow, I love what you're doing, doctor. This is amazing. Okay, so to sum it up, you are running a mobile app that will allow people who don't necessarily have smartphones to be able to go there, ask questions, especially the ones that are a little embarrassing, right? Like maybe sexually transmitted diseases, and they have access to a doctor. They get to get some professional advice without necessarily having to go see a doctor. But when they do find that it's maybe elevated and they need to see somebody, the app is directing them to their nearest physician. Is that correct?
Yeah, that's fine. Yeah.
Oh, that's
So we are
so
able
cool.
to help them. Yeah, we are able to help them solve the problem. We are also able to direct them to the nearest hospital so that if they have to do further tests and also provide treatment for them.
Wonderful. So now also too, if someone is a traveler in visiting Ghana, are they able to also get access to this, or this primarily for locals?
Yes, once they have the app, they are able to and reach out, and we're also able to provide them with answers, especially for travelers who come and they have questions about immunization. They want to find out the prophylaxis for malaria and all that. We're able to provide them with those answers to provide them and to make them adequately ready before they come to Ghana.
Wonderful. Well, thank you so much for joining me, Dr. Emmanuel. And everybody, thank you so much for watching today's episode of Ask the Doc. If you want to find out more about what he is doing at Bisa Mobile Health, please go to Buzz TV at iwannabuzz.com. And we'll see you next time. Thank you so much. Bye.